Shows it's letting me record.
Awesome. That's great, because sometimes it will not.
Yes.
Let's try that. All right, let me just.
And then whenever the doctor gets in here, will you, I think you'll have to do that where you pin to make sure that like it stays on them the whole time. So if one of us asks a question, it'll still be recording.
Yes, I'm not, when you say, I'm not sure what you mean, because normally it records.
Well, I mean, it won't, so like basically next to the person's name, where when you get on participants, you can hit the little dots and you can hit pin. So then if someone else like talks over them, it will still show the person that we actually want the video of on camera and not one of us.
So am I pinning myself?
Is that okay? Is that where, okay, they'll be on, yes. And let me see if it'll let me do it for you. It probably won't.
I'm
Yep,
trying to
it's
let
actually letting me. Okay.
Can you, well, I guess I'm not, I know, I kind of know what you're saying, but I'm not sure how to do it from my end.
I think I got it. It looks like it's working. It says pin. Yeah, so it
Okay.
should just record your screen no matter what, who's talking.
Okay, so I've tried to give everyone permissions, but it's not letting me do the last several people that have joined, and I apologize for that. I'm recording it on my end. Once we're done with the interview, I will get it sent to you via WeTransfer, and I'm not sure why. Is my throughout this whole time that we've used Zoom, it's been hit or miss. Sometimes it will let me help like everybody record, and then sometimes it will not, and I don't entirely understand what the problem is. It looks like now it's just letting me let some of the people record. It's a lot of people, way more than what I don't know if I've got multiple people from same like locations or not, but this is way more than what I thought. Some of you may have more than one person from your news station. Wow. Okay. Yeah, you've got multiple people. Some of you. I'll let y'all sort that out. Sort that out the way. Let's see. Allow. Okay, let me see. Well, not letting me do it. When we're done, I don't know. I think there are only 2 of you that is not letting me allow you to record. I don't know why that is. I don't know if everyone can hear me and can you see me and hear me okay? Is everyone okay? Okay.
Yes.
Dr. Patel is on his way. So KNWA, you've got a lot of people on here. It looks like. Okay. Let's see if I can. Hey, Dr. Patel. I've got it set up and ready and recording. So if you want to come on in and have a seat, I will back you to something. I've got everything set up for you there. And it's ready whenever they're ready, if you're ready. Is everyone there? Are y'all ready to start?
Yes.
Okay. And we will begin.
Hey, we need a moment. We're having trouble trying to get the rolling on our end working.
The what?
The rolling on the interview because we haven't been able to record.
Okay, I am recording it on my end, so if you have a problem, I'm gonna send it out immediately after via WeTransfer if that helps.
That will be wonderful. Thank you.
Okay.
So then, yes, we are ready to get started.
Okay. All right, so y'all feel free to start questions.
Can we first just get you to say and spell your first and last name and give us your title, please?
Hey, good afternoon, ladies, and I assume gentlemen are also there. So, my name is Naveen Patel, and I'm the Deputy State Health Officer, and it's spelled Naveen. Last name is Patel, P as in Peter, A, T as in Tom, IL.
So can you walk us through how this outbreak was discovered? Where is it isolated to a certain area? How many hospitalizations or cases we have?
Sure. Basically, the Department of Health gets notified when certain type of cases are admitted to the hospital, and that's how we were notified of a case almost a week ago. That's how we notified, and when that came to our notice, we started investigating as to what's going on, and that's how we discovered that there are issues and many other cases that were involved, and that's how we get notified. So to give the more details, as of now, we know of four people who have been admitted at any given point of time. So far, four people have been admitted to the hospitals, and again, this number changes every day. So we might have an additional admission later on today. But as of this moment, when I'm talking, four people have been admitted, and some of them have been discharged also. So far that's the number.
Can you
What is
say
the
are these,
condition of the people who have not been discharged?
Ma'am, I think they are still undergoing treatment, so I don't think that we would be able to comment on that because the treatment is ongoing. And again,
where,
this is a serious illness, so it should not be taken lightly. So that is the whole reason they are admitted to the hospital, and the patients are quite sick.
are these four people that were admitted, are these University of Arkansas students? And is this isolated to Fayetteville or Washington County?
So, as for the current information we have, yes, it is around the Northwest Arkansas part of our state. We are still gathering information and data regarding how many people have been infected, how many people have been exposed, so on and so forth. We hopefully will have that information. Hopefully by tomorrow or day after tomorrow, we are analyzing those. From my understanding is the people who have been exposed, they about potentially 100 people responded back to us that they had symptoms. They might have had symptoms in the past few days, have recovered, or currently have ongoing symptoms. So around 100 people, it would be a rough number that I would say who have had some sort of symptoms. And again, we are trying to dissect and make sure that this is not related to any other respiratory illness or gastrointestinal illness.
What is
So
worst
there's,
case scenario here as we're seeing this many people contract the illness?
So this infection is caused by a bacteria which is present in our intestines, and also in many other animals, and so it's known as E. coli, and it produces a kind of a molecule called toxin, and it can be severe. Generally most people recover, majority, more than 95% of the people recover without any issues. They might have nausea, a couple of episodes of diarrhea, abdominal pain, fever, those kind of things. But the problem arises when people start having severe abdominal pain, bloody diarrhea for a long period of time. They're unable to keep anything down. They might become dehydrated, and when it gets that serious, it has the potential of affecting the kidneys, and it can lead to kidney failure. So we have to be very wary of those complications. So that is why people have to be careful and seek care immediately if they are not feeling well.
at this time, can this be isolated to a certain spot? I mean, are you saying this is coming from the university? Is it coming from a specific restaurant or a specific place? Or do you still
So
not know?
the investigation is still ongoing, and our staff at the in the field are inquiring about potential sources of exposure, what type of foods all these people were exposed to. We are gathering that data. So in general, we are still working on it, and hopefully should have answers in next few days. But what I would like to advise people is, make sure that if you're using any food products, it's properly washed. If you're eating meat, it's properly cooked. And most importantly, make sure you wash your hand every time before you eat food, after you eat food. So, even if there's nothing, you might touch something. And then if you don't, and if your hands get contaminated and you eat food, you might get infected. So just try to practice common sense things like washing vegetables and fruits, preparing your food hot, cooking the meat properly, and washing your hands every time you touch or eat food.
And when
Are
was the
you
last? Sorry. And when was the last time there was an E. coli outbreak?
E. coli outbreaks are very common. Sometimes it's usually restricted to one case. So it's we have that frequently within both Arkansas and the United States. Currently, even the CDC says that there are some outbreaks going on in the West Coast. We just had a call with them this afternoon. So usually this is a very common type of outbreak when people are exposed. Most commonly, it's related to green leafy vegetables, but sometimes meat products are also implicated. So, but having so many cases within a short period of time is concerning.
Are you able to share with us if the people who were hospitalized have Northwest Arkansas addresses? What I'm getting at here is, are these people who have a home address from Dallas who are maybe in the area from college, and this could have been brought to the area by a college student?
We are still not sure about all that details, ma'am. As I said, we are still gathering all the information. We have to analyze the data, but we cannot pinpoint that this is restricted to a certain part or from someone traveling from out of state and bringing it. We cannot answer that question as of yet.
Should, until you do know where this is coming from, should students or anyone on campus be concerned about eating at dining halls, restaurants, things like that?
Again, as I said, we still do not know what the source is. We are working very closely with the University of Arkansas at Fayetteville, their leadership, their medical team, and other associations within the university. And we have given them general guidance of what needs to be done. And the university also is very proactive in encouraging students to wash their hands, in cleaning common surfaces, and so on and so forth. But at this time, we would not recommend anything that the students do to stop their routine activities.
Is there any reason to think that maybe this E. coli outbreak could have anything to do with increased levels of E. coli, specifically in Beaver Lake? A lot of times we'll get notices from the Department of Health saying that swim beaches are closed due to high levels of E. coli.
Yes, ma'am. No, not at this time. I don't think that would be a source that we are concerned right now.
Hey, Dr. Josh Harbison, news director over at KNWA as well. I have a question. How concerned should people who do not frequent the University of Arkansas be concerned about this? Because the area in Northwest Arkansas is pretty large, and yet we're hearing a lot about mostly the U of A.
Yes, again, as I said, if general common sense precautions are taken, I don't think this should be a cause for concern for people around that area. As long as you wash your hands, cook your food and wash your food well, I think those general guidelines do apply. It's a very unfortunate situation, but we are all working together to find the exact cause of it, and hopefully we'll have an answer in the coming days.
One other question to follow up on that. So you say 100 folks have been have said they've had some sort of symptoms. 4 people in the hospital at this point. Of those folks, are most of them connected to the university in some way, shape, or form, whether they be a student, a teacher, or staff, or something like that?
It appears so as of this time.
And so that would also include the 4 people hospitalized were also in some way involved with the university.
It looks like it appears to be of that side. You know, we are unable to interview those people hospitalized because they are sick, but it appears as of now that is the case.
Is that it? Does anyone have any other questions?
I think that's all for me. Thank you. I appreciate it.
Okay, I'm gonna try to get this sent to the people who originally contacted me, and I'll probably also send it to the general email addresses for each news station, like news@KNWA. And I'm gonna do that the minute we're done. I'm gonna download the video and get it sent out. So if you didn't get it one way or the other, I'm gonna get it to all of you.
Thank you guys
Thank-
so much. We appreciate it.
Yes, thank you.
Thank you all. Appreciate your time. Thank you.
Excuse me. I had one question. I'm so sorry.
That's okay.
Is there any my apologies. Hunter Myers. I'm from the Arkansas Traveler at the University of Arkansas. Is there at this time any federal intervention, or has the CDC been notified, or has any protocol like that been triggered?
Yeah, yes, absolutely. You know, we always like to collaborate with federal partners because, you know, have they heard of any other outbreaks nationwide or in neighboring states about, you know, similar kind of exposures? So we have conveyed to CDC and you know, they are not in the know of any outbreaks either in the surrounding states or nationwide as of now. As I said, there are a couple of other outbreaks going on in the West Coast, but not close to here in Arkansas. And yes, we do like to collaborate with CDC, and especially if we have samples that we test and they come positive, we always try to send it to CDC for confirmation and further analysis. So yes, we are partnering with CDC, and they have not provided any guidance, and they have told us actually that we have quickly identified this outbreak and done everything that has to be done to keep our citizens safe. So that's where we are as of now. And as I said, as we analyze more data, we should have some information over the next 2-3 days. In the meantime, I would encourage all citizens, as I said, to, you know, wash your hands as often as possible, especially before eating food, and to cook your food well, especially the meat products, and wash your fruits and vegetables. And we'll keep you updated if we have more information later on.
Yes, sir. And at this time, it does not appear as though this outbreak is connected with infections on the West Coast, you said?
Yes, that's what it appears to be, according to what we have been notified.
Okay, wonderful. Thank you, doctor.
Thank you.
Anyone else? Okay.
Thank you.
Thank you.
Thank you.
Thank you very much. Have a nice
This downloaded.
Right, thank you.
Thank you.